when lives are on the line.
Are there any obvious injuries?
These men and women will risk theirs.
The lad who was driving got blood coming out of his face.
To save yours.
RTC truck.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear.
There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The two Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof. Oh, yeah. He's got a big cut to his head.
5 million people rely on them.
All right, sorry, sweetheart.
To deliver cutting-edge emergency medicine.
We're just going to go to sleep. He's not looking particularly good.
At high speed.
If you can activate your major hemorrhage protocol.
Every day brings high anxiety.
Sylvia?
Yeah.
How old are you?
Oh, I don't know.
Not sure.
Yeah, she's quite confused, isn't she?
I have to admit, I'm really worried about Sylvia. She's so confused. She can only say just yes or no.
High risks.
And where's Mossby's perm?
In his chest.
Right.
His throttle's jammed on his bike. He's been going over a jumper and it's thrown him off. He's landed very heavily on his shoulder.
And high emotions.
When we got here, they told us that she couldn't be moved.
We're not sure if she's dislocated a hip or if she's fractured a femur.
It's really good medicine, so we can straighten that leg for you.
The sound of the siren at Air Ambulance HQ means the team have seconds to scramble. And today, there's a case that involves not one, but 2 patients.
Autopilot is engaged, source of trip engaged. Breaking over to York.
Dr. Sarah is on duty with paramedics Kit and Matty.
I'm turning. Right, mate, can I have eyes in? Yeah, eyes in, mate.
We're heading over to York. It's not a great story at the moment, but as far as I understand, a couple of ladies in their 50s to 70s have been riding their horses, and something must have spooked them because they both come off. I think one of them's hit a tree, the patient, and sound like they're quite injured, so we're going to go over and see if we can do anything.
I've got visual with 2 DCAs now, Gary. Visual? Yeah. Guys, so the DCAs are in the 1 o'clock.
RRV in the woods, south of the DCAs.
Got it, visual. I think that car's leading them down into it. Can't see no wires. No. Can't see anybody flying out of Elvington. No livestock or anything, is there? Horses, well, there's 2 horses run off somewhere. That one down there, isn't there? Air Desk 99 overhead, see you looking to land.
Roger.
Pilot Gary will have his work cut out landing here. The fields are dry, and dust clouds kicked up by the rotor blades can be deadly.
Yeah, it's going to be a bit of a brownout. So, got it out. Leave it HM, mate. Okay, got good wind on the nose, so just call us if you can see a brown cloud coming up behind us, Kim. Yeah, you got a dust cloud coming. All good left, mate. Okay, leave us down.
A mother and daughter have both been seriously injured after they were thrown off their horses.
Hiya. Is it just this one patient? Oh, golly.
Dr. Sarah will focus on the older patient, while Kit goes to find the second rider.
This is Sylvia, who is Julie's mother. Okay. New horse, it bolted. All right. So the other one took off afterwards. She's hit a branch and come off. Okay. Initially, GCS was 9 initially.
Oh, right.
She wasn't talking at all, but her eyes were open and she was localising to pain.
Yeah.
She's now up to about 13. Okay. She is talking to me, but she's not answering questions appropriately.
GCS, or the Glasgow Coma Scale, is a measure of consciousness, and pensioner Sylvia Bellwoods has been worryingly low.
Sylvia, can you hear me?
Sylvia, I'm just going to have to cut your jumper.
Stick your tongue out for me. Sylvia?
Yes, darling.
Stick your tongue out for me.
Oh.
Sylvia?
Yes, darling.
Stick your tongue out.
Yes.
Okay.
Yeah, she's quite confused, isn't she?
Sats are 92. Have you had them any better than that?
93 is the best that I've had.
Okay, will you get some oxygen, please? So she's got a chest wall injury here. She's in pain when I touch.
Sylvia's not absorbing oxygen properly. It looks like she may have a punctured lung and a head injury.
Sylvia, take a deep breath. Okay. Take a deep breath, love. Take a deep breath, Sylvia. Okay. She's not choosing to do that, bless her. Airway-wise, we're sort of set, aren't we? B-wise, we're not happy about, so we'll get some oxygen on. She's sore when I touch here, but there's nothing much to see. Let's just get some of these things off.
20 yards away, Sylvia's 56-year-old daughter Julie is also showing signs of serious injuries.
How's that patient?
So that's 91, 92 on her chest injury, but that seems to be it so far. Both off to Leeds then.
Yeah, now it's deciding who to go. This lady is GCS of 13 best.
Fine, so it's probably best for her to fly then. It's 40 minutes by land.
She's also got
Sylvia.
She's also got low sats as well.
Has she? Cool.
As it stands, I'd rather keep her away.
And going in the helicopter.
Yeah, that one.
That one can go by land.
Sylvia, can I put a little needle into this arm? Yeah. Do you feel sick at all? No. Okay, lovely.
It's clear today's falls may have left Sylvia and Julie with life-changing injuries. Both require treatment at a major trauma centre.
How are we doing?
Left rib pain. Chest injury.
Almost certainly got an pneumothorax, hasn't she there?
Kit suspects Julie has a collapsed lung.
Any pain in your legs at all? Can you feel me squeeze your legs? Yeah, give them a little wriggle.
And Dr. Sarah is concerned about her mother's confusion.
Sylvia? Yeah. How old are you?
Oh, I don't know.
Not so sure.
Sylvia? Yeah. Do you know your daughter's name? No. No.
The farmer who owns the land found Sylvia and Julie and called for help.
Do you know how long she'd been there before I got here?
Well, roughly 20 minutes at the longest.
And was she talking to you at all in that time?
No, she never spoke a word.
But she had her eyes open
She had
the
her
whole
eyes
time?
open
Yeah.
and was grabbing, trying to grab.
Yeah, like she was when I got here.
Yeah, like when you got here, yeah, she was about... It must have been, 20, 25 minutes top.
Kit and the team are putting a neck collar on Julie and attaching her to a scoop stretcher to immobilise her during her journey to hospital.
Sylvia, we're going to take you to the hospital.
Oh, yeah.
Yeah?
Oh.
Do you understand?
Yeah.
Can you stick your tongue out for me?
Yes, love.
Can you squeeze my fingers?
Okay.
Good girl, well done.
Sarah has decided that Sylvia's confusion means she must take priority over her daughter. She'll be flown to hospital for a brain scan.
Right, we're going to come up towards you, OK? No, sweetheart, you keep your hands there.
Good, Sylvia.
Keep your head still. Okay, one slide. Ready, steady, slide.
Let's get her strapped in and then let's get her into the Flexalon so she's a bit more comfy.
Relax back.
Julie will be taken to the same hospital by road.
Lovely. So we're going over this tree stump here, guys, OK?
Right, just get some blocks.
Our monitor.
Are things generally improving, Sarah?
Apart from her sats, which we're not.
Right.
The GCS, she's just very confused.
Both Sylvia and Julie's injuries are so severe that the team will have to split up.
I think one of us should go with the other crew.
Okay.
It's 3/4 of an hour, and she's still got really high rest, and she's still quite sore.
Kit will monitor Julie on her way to hospital, and Sarah will stay with Sylvia.
I have to admit, I'm really worried about Sylvia. She's so confused. She can only say just yes or no or yes, darling, which is what she keeps repeating. It sounds like she has banged her head. There's nothing to physically see on the outside. But yeah, the confusion isn't great. It's really not picked up as nicely as I'd liked it to. Her oxygenation is really poor. Initially she was complaining of chest pain, but that seems to have settled, but I don't think she can remember what's occurring. So I just need to get her to hospital nice and quick, ready for a scan. But I'm going to keep her awake, giving her some painkillers, keep her nice and warm, and hopefully start to improve.
Videos we have got. We've got leads on 26225, and your radios are working.
Sylvia is being flown to the trauma team at Leeds General Infirmary. Either of her injuries could be life-threatening.
The horse is quite tall. They go quite fast, although people do wear a lot of protective equipment, which they should do. But lots of head injuries, when people tumble off, they tend to go forwards. A lot of neck injuries, spinal injuries. To be honest, literally anything can happen with a horse, but yeah, well, we do see an awful lot of injuries.
A bit nose down there.
Sylvia is being taken to resus,
Cheers, Gary.
where the full extent of her injuries will be determined. She may require emergency surgery. It's been a devastating day for the family. Mother and daughter requiring treatment for major injuries after a freak accident with potentially lifelong consequences. All the team can do is return to base and await news from resus. It's another morning at the Topcliffe Air Base, and paramedic Pete is in a bit of a tangle.
I've been given the lovely job of sorting out the spider straps. They've just come out the dryer. So these are an 8-point harness system really that we use to secure people to scoop stretchers when they've been immobilised. And obviously after every job they have to go in the wash where they get disinfected. Unfortunately, when they've come out the dryer, they come out in a similar state to this. And it's an absolute nightmare to put together again.
COVID restrictions have just been lifted, and people are getting back to being active around Yorkshire.
I've got a job for you, mate.
Okay, mate.
I need you to set off towards Doncaster Motor Park, and I'll give you a grid reference.
Pete's tangled straps will have to wait.
Sierra Kilo 667 979.
Pilot Harry is flying Pete and paramedic Tyrone to South Yorkshire. It's a 50-mile flight.
Flaming traffic, helimed 99 Alpha, just lifted from Topcliffe, routing south-east bound towards York.
We've been called to a motocross park in Doncaster in South Yorkshire, so it's a long way from where we are at Topcliffe at the minute, to a chap who's come off his motocross. The dispatcher's spoken to the first aider and the patient's brother. There's confusion of whether an ambulance can actually get to the patient, but it said that his injuries is that he's probably banged his head and had a loss of consciousness for about 2 minutes, and he's got shoulder and arm pain. Apparently he looks quite pale and he's not in a good way. The DCA has just got on scene, so we're just awaiting a further update from the dispatcher, but we're making our way there to kind of get any more clinical information other than what we've already got.
Motocross riders can reach speeds of 60 miles an hour and jump 30 feet or more. Falls can be fatal.
Right, okay, I'm going to do a low pass just to wreck it, make sure we land somewhere sensible. Yeah, it's got to be that bit just short of them tyres. We look now to the right, doesn't it?
What,
with a muddy puddle to
yeah.
So I'll land just before the muddy puddle.
It's difficult terrain for pilot Harry.
The thing is, it's hard to tell where the ground undulates. You sometimes can't see it with this.
Yeah.
A lot of dust. Happy with visuals.
Dust is all behind us.
Still happy with
Dust coming forward.
Still happy with visuals.
Browning out.
Right, I'm just going to let the
I can see.
dust settle a bit. Yeah, happy with that.
Still visual, good drive.
Yeah, okay, good visuals up
Looks
front.
quite solid, that ground, Harry. Right there.
Yeah. Right.
Tyrone knows their patient's injuries could be life-threatening.
All right. And where's most of his pain?
In his chest.
Right. Right. Michael. Hello. You all right? Do you know what's happening?
33-year-old Michael Wallace's pain is so extreme, he can't speak.
Michael, my name's Tyrone. Just quickly, and my colleague just told me what's happening. Just tell me where most of your pain is, if you can point to it. Does that hurt when I press? Yeah?
The team suspect that Michael could have a collapsed lung.
Right, just take another breath for me.
Tyrone is checking for reduced air entry to see if he needs to be flown to a major trauma centre.
He says that's a 95.
Oh no, yeah.
Oh, no. He has got air entry both sides. And he is laid down, so that's a 95.
It sounds like his throttle's jammed on his bike. He's been going over a jump and it's kind of thrown him off. He's come off the bike. He's landed basically out on his shoulder, on his arm, and the bike's actually landed on top of him. Fortunately, the bike kind of sort of glanced over the top, so he's not taking the full impact of that. But what he has done is landed very heavily on his shoulder. He's got previous injuries before. He's also a bodybuilder, so he's got quite a lot of weight behind him when he's gone down. So he's landed sort of on sort of this side. So it sounds like he's possibly clavicle, shoulder. Sort of it's like lots of soft tissue and tendons and ligaments around there, or possibly even his shoulder blade, his scapula.
With these injuries and a collapsed lung, Michael's life could be in danger.
Right, let's get him onto a scoop then.
The team's priority is to get Michael off the ground. A first aider at the track ran to his rescue.
The gent was complaining of sort of pain in his collarbone, sort of to the front as well, to his chest and to his back. So I've just sort of mobilised him as best I can, made him comfortable, and had to get the ambulance out here. And obviously, air ambulance has come as well, which is grand here.
With Michael unable to talk, Tyrone's diagnosis relies on touch.
Yeah, don't feel emphysemic. Right. He's torn his muscle before on that side. Right. Probably might have done it again. He's got a lot of pain on moving. Right. Big lad, aren't you?
Yeah, he's a bodybuilder and all, pal.
We're still lifting him, aren't we?
Well, I thought we can get some colleagues down.
So you're in charge of log rolling? Yeah. Michael, we're going to roll you to the left. Put a board underneath you. Back onto that side. One to this side. Lift you up onto a stretcher. Is that all right?
Ready, steady, roll. Sorry, Michael.
Sorry, mate. Just get that.
Okay, I'm down. Ready, steady, down.
Ready, yeah? Yeah, whenever you're ready.
Getting Michael off the ground won't be easy, and it could be risky. He weighs in at 18 stone.
Sit more, Pete, if you can. Sorry, buddy. I'll try to do that without holding there, but I don't think it was going to work.
He's got left clavicle, upper chest pain, and left shoulder blade pain. He's got previous muscle tear on that side. ABCs are all good. His sats on air were 95, laid down. He's got equal air entry and expansion. Plan is load onto the DCA and across to local TU with the crew.
It looks like Michael has had a very lucky escape. He's going for x-rays at a local A&E.
1, 2, 3, yeah.
Okay, buddy.
It's been a dangerous day at the track.
Just before as well, we'd had another rider who's got dislocated collarbone as well, so he's literally 5 minutes before, and he went to A&E with his partner, and then just as I was saying to him, I got a call. There's another guy down, and the patient here, Michael, he's he was down as well. So yeah, it's been chaotic today, definitely.
It's a really popular sport. It's also a very dangerous sport, and unfortunately, in cases like this, you're not just relying on the ground and your own skill. Because if there's a problem with the bike, and the problem with the bike happens in mid-air, there's not a lot you can do about it. So it's yeah, certainly when it's motocross season, we do a lot of jobs on places like this quite frequently.
Michael will be driven 8 miles to hospital, where he'll need scans. His bodybuilding career could be over. Tyrone and Pete know it probably won't be long before the helicopter is back at the track.
So do not move now unless she is in danger and do not splint any injury.
On the air desk at Nostell, dispatcher Pete is listening in to a 999 call.
Just reassure her that help has been arranged, okay?
That help will be in the form of the air ambulance.
Hi, it's Pete on the air desk. Have you requested Helimed, ever?
Yeah, hi, Pete. We're just in the middle of nowhere at this primary school. We've got an 11-year-old female that's had a fall in the playground with an obvious left knot. She's also been on the floor for 2 hours, outside, freezing cold. Just wondered if you were available ever.
Yeah, that's all received. I'll get them on the way from Topcliffe, over.
40 miles away at RAF Topcliffe, the scramble phone is ringing.
Good morning, Topcliffe Air Support Unit, Gav speaking.
Paramedic Gav is being sent to the scene with colleague Gemma.
Cheers, mate. See you, bye.
We'll all the taxi out, make blind calls, and we'll disappear. We'll get to the motorway and go northbound.
Okay.
Details are a little bit limited, but I believe we're going to an 11-year-old female at a primary school, we think, who's fallen and got an injury to the upper part of her thigh. There's an ambulance crew on scene who are requesting some assistance, I think, because they're struggling with either gaining vascular access for pain relief or they just need something a bit stronger. So we'll see what happens when we get there. So we're just making our way there. We should be there in a couple of minutes.
The local ambulance crew have been unable to move the patient since her fall due to her complex leg injury.
It's in a little kind of village with a triangular area which will be quite good for ID.
There are around 40,000 injuries to children in playgrounds each year, resulting in a hospital visit.
Okay, so that's us now committed into wind.
Younger patients can deteriorate faster than adults, so seconds count for Gav and Gemma.
Okay, that's for the high ground to go around, that's us now LDP.
Pilot Owen is aiming to land in a field close to the local school.
Yeah, I've got the school. Actually, so I can land this side then.
Yeah, just turn the fence, perfect.
Yeah. Okay, let's come to the hover in the field then. No signs of wires.
No.
I'm going to put the tail towards them.
Yeah.
Okay, and the left skid on the low side.
Okay.
I can see where the slope is here.
Yeah.
Land Rover's been driving over this, so tractor, so it looks fairly firm.
Yeah.
Okay, go.
ADS99 lifted. Sorry, landed.
Engines off.
Hi guys, all right? Yeah, good, thanks. All right, okay, cool. Yeah.
Right, this is Angel.
Hi, Angel.
11-year-old.
I'm Gav.
Angel Ramsey is in severe pain.
What's happened today?
She's fallen, sort of crashed into another young lad.
Yeah.
Didn't really see it happening, and he's just basically knocked her onto the floor in this position.
Right.
Pain's 10 out of 10. She's complaining of leg pain.
Angel's auntie quickly came to comfort her, along with her mum.
We'd got a phone call to say obviously my niece had had an accident at school and that they were obviously on the phone to 111. So we ended up coming over here to obviously see if we could take her to hospital, but when we got here they told us that obviously she couldn't be moved and that they were waiting for the ambulance to come.
Morphine?
1 milligram. And,
so far, yeah?
So far, and then Snox.
So if I get some monitoring on, would you mind drawing me up some ketamine?
It looks like Angel has fractured her thigh bone and dislocated her hip. It's a rare injury in a child so young, and potentially very serious.
Right then, what we're going to do, we're going to give you some special medicine, okay, now, which is going to make you feel like you're a little bit drunk. And I hope you've not been drunk before, have you? No. So it might make you feel a little bit lightheaded, like you're away with the fairies, and then we can straighten that leg for you, okay? But the good thing about it is afterwards, when it wears out, you won't remember, okay? But it's really good medicine to help you straight, so we can straighten that leg for you. Is that all right?
Right, so that's your ketamine, that's your flush.
How are we doing? Can you? Okay.
What numbers for your pain now, love? You don't know.
Okay. Does it feel any better than it did before?
You're really dizzy.
That's good. Okay.
The team need to straighten Angel's leg to reduce the risk of internal bleeding.
Can you give us some more?
The ketamine is starting to take effect.
You straighten this leg for me.
Angel, that's your good
Mum, just to let you know, she will scream out, Mum, okay, but the medication will be working, okay, so... Right, I'm just going to lift this one up and we're just going to straighten that. Okay, on 3. 1, 2, 3. Well done, Angel.
Well done, darling. Brilliant. Well done.
Well done, sweetheart. That's good.
Do you think it's a bit high up, isn't it? What do you think?
I think that's a bit too high to traction.
It's mid-shaft, isn't it? Well done, Angel. Well done.
Angel's brake is too high up her leg for the team to use a traction splint. They need a plan B.
I wonder if we could vacuum splint it just to keep it as she is.
Yeah, that's a good idea, yeah.
Like that.
We're just going to get a sort of vacuum splint to go around it and suck the air out, keep it tight like a plaster cast and just hold it in place. Okay.
Yeah, just an update. It's an 11-year-old with a query fracture, query dislocated hip, query femur. We've straightened it, given ketamine, and our intention is to fly to Harrogate over.
Oh yeah, just come into your bottom here, look.
Yeah, that's it.
That's it.
Air is being pumped out of the vacuum splint so that it tightens against her leg, keeping it immobile.
That's it, Angel. You did really well. Well done.
That's it. Well done. Angel has had a fall. I'm not quite sure what's happened while she's been at school. She's sustained an injury right to the top of her leg, so we're not sure if she's dislocated a hip or if she's fractured a femur, which is the big bone in your leg. Either way, she's in loads of pain, so we've given her some ketamine, which means that we can straighten her leg, and we're going to transport her to Harrogate because we're quite a long way from the hospital, so by air we'll save loads of time and get her to hospital.
Got the handles, yeah? Okay. On lift, ready, steady, lift. I'll let you climb first, just in case. I don't want to let go of it.
Is she on?
Yep, she's on. I've got it, yep. No, we're okay, thank you. Thanks for your help, guys. Okay. She's had a really sort of freak accident in the playground where another pupil had sort of collided with her.
All clear left, clear right, let's go.
She was very deformed when we got there. The ambulance crew did a great job in sort of getting some IV access and getting some morphine on board. We've been able to come along and give some stronger pain relief ketamine, which has enabled us to straighten her leg and then get her onto our aircraft and fly her to Harrogate, which is the local trauma centre.
Over the next few hours, paediatric doctors will determine the extent of Angel's injuries.
Right. Okay, pause, and we'll go straight.
She may face major surgery.
Okay, so if we start with the front flap.
Yep.
It's the start of another day at the Nostell Air Base. For the next 12 hours, Dr. Andy must be prepared to face any kind of medical emergency.
At the start of every shift we come in and we'll do all the kit checks, so we go through all the bags, all the drugs, check the aircraft, all that sort of thing, just to make sure everything's there, everything is as it should be.
This means work begins before they are scrambled.
Things have changed a little bit in the current climate with coronavirus and so on. We now have to not just think a little bit more about the types of jobs that we go into and kind of how that would change, but also the kit that we carry. So we have to carry a lot of personal protective equipment, and there are different levels of that. Depending upon the guidelines that come out, we have to change what we wear for certain types of jobs.
Andy is soon on his way to a job with paramedics James and Paul.
Right, okay, left. Where is it, this job? Donny somewhere. Are they unconscious or anything, or does it sound like level 2?
She said short of breath.
Okie doke. So it's on a main road?
Yeah.
There's no one on scene?
I'm not sure yet. First crew was 25 minutes away.
Pilot Lee is flying them the 17 miles to Doncaster.
We've been tasked to a lady, I think, I'm not sure how old she is, but she's called 999 complaining of shortness of breath. Gemma, who's the dispatcher for us today, she's called the patient back, and when she's spoken to her, it's turned out the lady's pulse rate is running at about 32, which is obviously very slow, and it may be that's what's causing or contributing to her shortness of breath. So we're heading along just so that if that were to deteriorate or were to need any interventions, there's a few things that we might be able to do to help with that. So not a lot of information, but we're on our way and see what we find when we get there.
2 minutes out, pre-land through.
Okay, doors on stretcher.
Secure the front, secure the back. Secure in the back.
Let's go from there. iPad.
It should be an easy landing.
So large open field opposite the house, effectively.
Not anymore, thanks to local developers.
Are you telling me what was a field is now an estate, a housing estate?
Now there is that sandy patch.
So not going to go for the sandy patch due to the dust implications. I might go for the one a little bit further on. Concerned about. Alright, any issues or we go round?
Roger, we are good to the left.
Roger, thanks. Okay, going down on that.
Roger.
Alright, so guys, there is an open gate in the right, 2 o'clock, about 70 metres away.
Okay.
Local paramedics have reached their patient, who was at home with her husband when she started to feel unwell.
Hello.
Hiya.
What's the story?
So this is Elaine. She's had for about a week with a short of breath. She's had chest pain for about 10 days. We've got a heart rate of 36 from our patient.
Can I just feel your pulse? Is that all right? Yeah, you got a lovely strong pulse. That's good.
68-year-old Elaine Reddy suffered a heart attack in August last year. She and her husband Jim are worried it might be happening again.
I think I would just convey to hospital, and I think access is a good idea, but I wouldn't necessarily jump in with it straight away.
Elaine's heart rate is dangerously low. Putting a cannula into her arm will allow them to administer drugs quickly if her condition suddenly deteriorates.
When you feel a little bit dizzy, we're just going to take that on the chair if that's okay, alright? So the last thing I want to do is be dizzy and fall, it'll make things worse. Alright.
The patient's got a slow heartbeat. It sounds like she's contacted her GP about it, and the GP's obviously booked an ambulance because they need to try and establish what's causing the heartbeat to go so slow. Now, she's on medication which has a habit of slowing your heart rate down, so beta blockers will slow your heart rate. However, there are like conductive problems sometimes in the heart which can cause the heart rate to go so slow. So, for example, different heart blocks within the conductivity system can make your heart rate go at various speeds.
So I don't know whether the guys have explained. Your heart's gone into what's called complete heart block, and what that means is the two bits of the heart, they're not talking to each other as they should do, and that's why it's now going a lot slower than would be usual, and that might be why you're feeling not so well.
The electrical impulses that tell the heart when to beat are not passing between the top and bottom chambers of Elaine's heart. She's suffering from the most serious form of this.
Probably the best course of treatment will be that she'll have a pacemaker fitted, which will then just be inserted just underneath the skin so that it can control electrically all the heart and to make sure that the speed of the heart is actually as it should be normally.
Andy is so worried about Elaine, he and James will travel with their patient to hospital in the local ambulance.
We're going to go by land, and en route obviously they'll be monitoring the heart rate, and if need be then they'll if the heart rate drops even more, if she becomes unresponsive, then they can start pacing her en route to hospital. Obviously we need to give her certain medication to try and keep her nice and calm if that happens, so obviously that's where they're going to go with her.
It will be a scary few hours for Elaine and her husband as doctors determine the course of action for her heart problems. Paul and Lee will meet the rest of the team on a landing site near the hospital. It's been a cold winter, but there's a glimpse of sunshine today, and the people of Yorkshire are out enjoying the weekend. But near the market town of Selby, one man's day out has ended in a life-threatening medical event.
Right, very slight winds, all clear right, nothing on top
clear
cliff.
left.
Yeah, you can get the iPad out, mate, get us en route if you want.
Pilot Owen is flying paramedics James and Rachel 25 miles to the emergency.
We're tasked from Topcliffe, which is our base in North Yorkshire. We're going down to Leeds East, which is the old Church Benton RAF airfield. The air desk's seen a call down there. We've had a report of a cyclist that's come off, believed unconscious, and may well have had a witness seizure. These can cause a bit of confusion really, because what we're concerned about is whether or not the patient's had a medical event and then come off the bike, or whether or not there's some trauma element to it as well, where they've come off the bike, had a head injury and then fitted. So there needs to be a little bit of investigation work when we get there.
98 Twitter. Clean. Yeah, we're 4 minutes out, Lisa. Just a quick one. Do we know if he's come round yet, or is he still unconscious?
He's coming round, but he's not coherent. He's not able to answer any questions.
There's a car there, parked up, and somebody is waving. Yeah, it's in my 11 o'clock now. So they're on the road at the side of the airfield.
Okay, but from that then, have we got access from the airfield to that road? Is that massive ditch, isn't it?
I doubt it. No, it's air desk. We're overhead scene. It's not on the airfield itself, it's on the road that runs to the south of it, if you want to pass that to the DCA.
Right, it's a massive field then, so we'd see any posts in this field. And we'll just come to the edge of the field and over taxi up.
Yeah.
Continuing, clear area arrival. I'll put the trim button in so I don't need the auto trim.
Happy?
You clear out to the 12 o'clock.
Thank you.
Their patient is at the roadside with two witnesses who stop to help.
Really sorry.
That's all right. What's happened?
I
saw it.
Yeah,
he was cycling. There was a cry, went out, a sort of, I don't know how to describe it, horrible sounding cry. I turned round and this gentleman was going like that on his bike.
Okay.
And as he hit the ground, he started to shake and fit.
So he got the bike out of his legs.
Yeah.
Lady on his back. There's the lady on his
Yeah.
Phoned the ambulance.
It's probably been out about 15 minutes.
So when you say out, how long's we actually shaking for?
Talking to him and saying to him, like, can you hear us? Can you hear us? Nothing at all. His eyes started to flicker after about 10 minutes.
Okay.
And then probably 5 minutes later, he started to say his kind of
you're right.
first word, really.
But the actual fitting activity, how long did that last?
Fitting activity, I would say a couple of minutes max.
Okay, all right. And do you suffer with fits normally?
50-year-old John was just starting out on his bike ride.
Do you suffer with fits normally?
No, it's just happened once before, last year sometimes, that it won't happen to me.
Okay. And did you go to hospital at the time?
Yeah, they revoked my driving licence off me.
Okay.
For
6 months?
Yeah, but that's like 2 years ago.
Shall we pop you on the ambulance? Let's see if we can get you up right, just for a minute, nice and steady.
You know what I mean? I'm all right.
That's all right. We'll see in a minute when you get up, when we're trying to stand you up.
John may appear fine, but seizures are deadly, and looks can be deceiving.
Come and have a seat on here, John, just for a second. We'll make sure your bike's safe. This young lad's John. He's been cycling along, he's literally gone sideways.
Okay.
Had a tonic-clonic seizure, as described, lasting a couple of minutes.
Okay.
And then being really out of it for about 15 minutes in total.
15 minutes, okay.
But actual seizure activity of just a couple of minutes.
Okay.
This has happened previously once before, a couple of years ago. They revoked his licence for 6 months, but then cleared him and got it back. So he has had something similar to this before.
Not diagnosed?
Not diagnosed with anything, no. He said just literally had one seizure prior.
Okay.
And nothing up until today. Yeah, he has bit his tongue by the looks of it, so it does look like, from what they've described, it does look like he's had a full-on seizure.
John has no recollection of how he ended up on the grass verge.
So I'm just having a look at the gentleman's helmet. It looks intact actually. There's no damage to it other than general kind of wear and tear. So looks like he's had quite a soft landing into this overgrown side of the road. So that's probably done him a favour really. So yeah, there's not enough damage on there to suggest that he's potentially caused a head injury, and he did have it on at the time.
Do you know what day it is today? And I know it sounds a little bit silly because you've told me that you're fully aware, you know where you are. But do you know what day it is today?
I forgot.
All right. Okay. Do you know what year we're in? Don't worry if not.
I can't remember what year.
Well, because you've had the seizure, haven't you? Everything's a little bit amiss. Who's Prime Minister at the minute, do you know? No, don't worry.
I can't remember.
Take your time.
Again, you're still coming around from this. You've had quite a long, unresponsive or certainly decreased responsive episode. All right. So it's perfectly normal to be a little bit confused and a little bit not really with it, obviously.
That's bizarre, isn't it? That's bizarre.
You're having trouble with that?
Yeah. Keep that there.
So you only had one seizure previously, you didn't have another one after that, did you? You just had one seizure when you... Yeah.
Mm-hmm.
Okay, all right.
And again, I felt like, like when I come round, I felt like I was with it. I didn't feel wobbly, like. Yeah. Like now I'm thinking, well, are you wobbly?
Seizures interfere with input of information into the brain, and therefore with memory. It's no surprise John is confused.
Okay. So your blood sugars are good. Okay, so it's unlikely that that's been a reason for why you've had, obviously, your episode today. All right.
Yeah.
So obviously we're going to have to pop you to the hospital.
What now?
Yeah.
James is happy that John is not in a life-threatening condition, so he will be driven to hospital rather than flown.
Give you that. There's no damage to his helmet, it's just general wear and tear.
Right, we're going to leave you with our two colleagues. All right,
well, thanks very much. Sorry,
short and sweet. No problem, all right.
John will need scans to determine the cause of his seizure, which came out of the blue.
Right, take care, sweetheart. All right, hope you feel better soon. No, don't be daft. That's what we're here for. See you later.
People, when they've had a seizure, they're because their body's working overtime, they're effectively doing the equivalent of a marathon in a short period of time. All their muscles are working hard, they're using lots of oxygen, so their brain's been starved of oxygen potentially because they've not been breathing properly. So it's not unusual to have this period of confusion for a while after, and that, depending on how long the seizure's been, that can be for quite a significant period after. And certainly what they've reported here is, although the seizure activity only lasted a couple of minutes, he has been unresponsive for quite a period after that, maybe up to 15 minutes. So it's going to take a little bit of time for him to come back round and for his body to normalise again.
For James and Rachel, it's back to base to continue their busy shift. Doctors at York Hospital suspect that John's seizure may have been caused by epilepsy, but investigations are continuing.
Shall we pop you on the ambulance?
He's not yet back at work and will be unable to cycle for some time.
Sylvia, can you hear me?
Horse-riding mother and daughter, Sylvia and Julie, both sustained serious injuries and have decided not to ride again.
Let's get her strapped in.
Sylvia had a bleed on her brain and was in hospital for 5 days. Julie required a full hip replacement on her broken hip, as well as suffering fractured vertebrae and ribs. After more than 2 weeks in hospital, she's now recovering at home.
Right then, what we're going to do, we're going to give you some special medicine, okay? And then we can straighten that leg for you, okay?
Angel, who fell in her school playground, had her broken leg pinned and plated in hospital. But unfortunately, there were further complications.
When I went to hospital, they found out there was a tumour in my leg. So when I went to surgery, they scraped the tumour out and put packing in it, and then put a metal rod in it so my leg can heal faster. I felt like really scared and like petrified and all like worrying about what's happening.
Thankfully, the tumour was non-cancerous and surgeons were able to remove it.
When I saw my x-ray, I saw one bone moved in front of another, and I was like really shocked because I was thinking like why I didn't think this would be a very dangerous break.
If she'd not had her accident, they would not have found the tumour, and it could have become life-threatening. But now, it's expected that Angel will make a full recovery in 6 months to a year.
Now without crutches and my recovery, I can see all my friends now and go to school and educate better than being online. I was so determined to get better because I wanted to do school again, do all the activities and see all my friends again.
Michael, hello, you all right?
Michael, who had a fall at a motocross park, did have a collapsed lung, as well as a broken collarbone, broken ribs, and a bleed on the brain.
Big deep breath for me if you can.
He spent a week in intensive care with a chest drain and had a plate put into his collarbone.
Can I just feel your pulse? Is that all right?
And Elaine, who suffered a complete heart block, is doing well after 6 weeks of rest.
It happened so quick, it was just like a dream. I thought, I'm dreaming this. This can't be real, you know. Pleased to say I managed to stay calm and didn't panic because I just felt like I was in good hands, to be honest.
Despite her previous heart attack last year, she could not have predicted this.
So I just assumed I was coming down with a virus and I just needed some help to sort it out. It's quite a surprise when it turned out to be so serious. When I arrived at the hospital, it became obvious I did need a pacemaker.
She's thankful for the team's help that day and is determined to make a full recovery.
I'm just so pleased that I am still here, can enjoy my family, even doing a bit of cleaning up. But just get back to life in general. It just gives you that feel-good factor.
When lives are on the line,
Are there any obvious injuries?
these men and women will risk theirs
The lad who was driving got blood coming out of his face.
to save yours.
RTC trap.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear.
There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The 2 Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof. Oh yeah. He's got a big cut to his head.
5 million people rely on them
All right, sorry, sweetheart.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high stakes.
Paul's doing drugs, he knows what he's doing.
Yes. It looks like this chap's got a significant head injury. We think it's probably due to some bleed on the brain.
Once he's asleep, connect him to a ventilator, put him in the back of that DC and off to the LGI.
High risks.
You can lose a lot of blood from a fractured femur.
He came off his motorbike and wrapped himself around a tree.
You having a good time?
I was.
And high drama.
I'm good, this is Tim.
You had one shot then, yeah? Three shots?
3 shots.
3 were in VF.
Saw the guy on the floor, a young boy, CPR.
Cycling is one of the UK's most popular pastimes. It's reckoned 25 million Brits now own a bike. And Yorkshire's country lanes are packed with riders. But with the thrills comes danger. And today at the Nostell Air Base, a 999 call is coming in from an accident near Leeds.
Hello, Gav speaking. Yeah, you. Yes, Brian's on you. Just set them off now. Cyclist head injury at Wetherby.
Dr. Brian and paramedics Paul and Pete are scrambling to the scene.
What's the pilot? Engage. What's the trip? Engage. Breathe. Great, yeah. Helipad out and off we go.
Roger. Good left.
All good in the hover.
Good calls to a cyclist of a push bike that's going to cycle, maybe hit by a car, who's potentially unconscious in the middle of the road in Wetherby. We're not entirely sure of any more information about the incidents. We're just waiting to get an update en route. But the concerns we have are obviously a head injury and damage to his brain or her brain. So we'll wait for some update en route to see what we're going to do, but potentially might have to pop this person off to sleep in the middle of Wetherby.
Yeah, quick update from Ron's on scene. It's a 60-year-old male, 60, that's been included with a car, got up in the air, landing on his head. He was wearing a helmet, but he is significantly cerebrally agitated. So yes, thinks that he probably needs to go to sleep. Proceed.
Yeah, it's all covered, mate. 1 minute.
It sounds like their patient might be in need of a life-saving procedure, called an RSI, where they'd be anaesthetised and their airway controlled.
Is this the main roundabout? Yes, the police car there.
Yeah.
Okay, so I'll put it on the road in this side of the big field this side of the roundabout.
Yeah.
Oh, I'll put it in that area where you can get out, yeah. In fact, I'm going to go into that field and you can just run straight to the police car a bit quicker.
Yeah, police car in the entrance to the hotel.
In fact, he's going to take you up there. The gap in the fence, yeah, there it is.
I don't think we've got a lift yet.
Yeah, he's up straight on the nose, mate. There's another car there.
Oh, is there?
Yeah,
oh,
I didn't see it.
No, we've got it.
Okay, out.
The injured cyclist is in the middle of the busy market town.
Hiya.
Hi guys.
This is Ryan, one of the doctors on Pete. Hiya.
Just a Peter, about 60-year-old chap, cyclist, wearing a helmet, hit by a car, thrown up in the air, landed on the back of his head.
Yeah.
Agitated, witnessed by the first crew on the scene. Been agitated like this throughout. This has been his best GCS.
Yeah.
I think he probably needs to go to sleep.
Yeah,
so
agree.
tried to get him in the shade.
Yeah, so I'm just trying to work out where to do it.
58-year-old Pete Galley is in a bad way after being knocked off his bike by a motorist. He's in danger of inhaling fluid into his windpipe and lungs.
You're okay.
Dr. Brian has no choice but to take over his breathing here in the street. It's a risky procedure.
Plan A, yeah, so a bougie.
Yep. Bougie, sonograte tube.
Yep.
Number 3, Mat 3 blade.
Yep. If that goes wrong, it'll be an eye gel.
Eye gel, yep.
If that goes wrong, it's a bag and mask.
Yep, no worries.
It looks like this chap's got a significant head injury. He's a little bit combative and we think it's probably due to some bleed on the brain. So the best course of action for him is to put him to sleep so we can rest his brain and hopefully it can all sort and regulate itself out. So what we're going to do now is we're going to do an RSI, so a rapid sequence induction, and what we're going to do is we're going to effectively stop him breathing and take over his breathing for him so that we can maintain all the blood pressure and pressures, or try and prevent pressures inside his head from rising too much.
Okay, so A, B, C, D, check, we've got everything.
Yeah.
Paul's doing drugs, he knows what he's doing.
Yes.
Team brief, everybody else happy?
Has everyone, have you seen all this before? Just done, yeah? So general anaesthetics, we'll give some drugs, a bit of silence.
Pete's life depends on every member of the medical team doing their job in exactly the right sequence.
once he's asleep, connect him to a ventilator, put him in the back of that DCA and off to the LGI, then a cup of tea for everyone afterwards. Anyone not happy with anything I've said? Paul, just give 2 mils of the ketamine, please, just to quieten things down ever so slightly. Right, so anyone not ready? Paul, off you go. Fentanyl first of all, please, then ketamine. Someone hold his hand for me.
Pete's being paralysed so the team can breathe for him using a bag and mask.
Rock in. You tell me.
Yeah.
Thanks. So CO2 is there. Bougie.
Dr. Brian is guiding a tube into Pete's lungs.
Through the cords. Got the bougie. I've got the bougie.
The procedure requires precision and would normally be carried out in a hospital.
Okay, bougie out, please. Some air in the cuff.
It could save Pete's life, but if it goes wrong, it could also kill him.
So, bilateral chest expansion. CO2. Saturation's 100. CO2, right, good. And then just do the blood pressure for me, please.
It worked. Pete's now in an induced coma. It should allow his injured brain to rest during the journey to the major trauma centre in Leeds. But his condition is worrying Dr. Brian.
I don't know why it's hypertensive, so let's just check again. So his pupils are okay, saturations are okay, blood pressure's high. Did that wife say any tablets?
No tablets, no allergies, normal fit and well.
Okay. I think I'm happy to go. How far to the LGI?
20 minutes.
Thanks. I don't want to be sick, so gentle. Thank you.
Brian is so concerned he's travelling to Leeds General Infirmary with his patient.
So we put him to sleep. The RSI went really, really well. Obviously now the most important part is to maintain what we've done and get him to hospital as soon as we can, because the most important thing for him now is to have a scan, see the extent of the brain injury that he might have, and then they can treat him accordingly.
Pete's life is in the balance. He's critically ill. The day starts so early at the Nostell Air Base, many of the crew sleep over, leaving paramedic George time for an early morning run today.
We've got places that we can stay over actually on base, particularly when we're working 12 hours as well. It means that I can get a good rest and a good sleep, but also I can go out and do a run in the morning and exercise. It's a really good way to keep yourself fit and healthy, both physically and mentally. I've got about an hour now just to have a little breathe, a bit of a cool down, do some stretches, make sure I get some breakfast, have a shower, make sure that I'm ready for my shift that starts at 9.
And not long into her shift, George is heading out with paramedic Paul and Dr. Andy.
Radios and lights, all set. Autopilot engaged. Auto trim engaged. Breathe. Helipad out to the northwest, lifting. What's the job? Motorcyclist. We have Paul in leg. We're heading up into an area just west of Skipton. The reports are a motorcyclist, 19-year-old, has come off his bike, and the 999 call said that his leg has snapped and that he's as white as a sheet. So that's clearly concerning. Obviously, it could be a major injury to his leg, and being white as a sheet, that could just be a response to pain, but also it could be a sign that he's lost a lot of blood. And if he's lost that much blood that quickly, then that is, life-threatening injury. So we need to get there as quick as we can.
They're heading for a farm in the Yorkshire Dales. Agricultural workers often use off-road bikes to get around their land. They help make farming the UK's most dangerous occupation.
Scan out information, Matty. We've got an ETA now of 10 minutes, 10.
Roger, mate, that's all received. I'm still listening to the call. I'm trying to get as much information as I can, which I will send down to the iPad to you. Over.
Right, we're over this next ridge, this area, and then drop down, and it's on the other side. Yeah. Let's do the pre-landers now. Okay, pushes orders.
Nothing on the warning unit, just the landing light on the list.
What's Jim?
That can stay in unless I call for it to go off.
So we'll drop down over the next hill, then the next ridge line. Yeah. Then drop down, and it's on the other side of that. Got a DCA at 1 o'clock?
Oh yeah, visual.
So where is the patient?
Maybe on the ambulance? Oh, hang on, that waiver near the car is pointing up the field. That can't be. In the red?
Somewhere far.
He's pointing to the...
Yeah, I see the guy at the far end of the field.
Where the hell's the patient?
Maybe he's in the woods, maybe it's a trail bike. Yeah, he said it hit a tree, didn't they?
It looks like the ground ambulance is a long way from the patient. The helicopter could be crucial to the biker's survival.
I can see a quad bike.
Whereabouts?
Where
Near the
the
entrance.
is.
In the trees, right. Well, I'm going to land near where that guy is in the red.
I think that's a good call.
Okay. So, I'm just going to continue in down here, and then you'll have to walk up the hill a bit. Yeah, there's the quad bike and just through the gate. All good. Wires on the left. See how we go with this slope. Okay, I'll put it down here. Be aware, George, you've got sloping ground to the right.
Yeah, okay, proceed.
I'll get out George's side so we're all just one door.
Okay, you're all clear out. The aircraft moved forward.
Hello.
Hiya. My name's George. Daft question. What's gone on?
It's just my leg that's gone. Not everything else is fine.
What were you on?
Motorbike.
Oh, not
No,
you went on
not
this?
No, motorbike.
And you've got yourself up onto here?
Got carried. If someone takes weight, I can kind of move on it.
Okay.
19-year-old Luke Calvert is a farmer and was off-road biking with his family when he hit the tree at 30 miles an hour.
Any pain in your chest or anything?
No pain anywhere, just apart from the leg.
Any pain in your neck?
No.
Did you hit your head?
No.
Did you have a helmet on?
Yep.
Any pain in your tummy?
No.
He's shrugging off the pain, but Dr. Andy is not sure he's as well as he seems.
Right, I'll start with these first. Have you got something else on underneath these?
There's just some pants on.
Any pain in your hips?
A bit where your hand is there, but it's like, where your right hand is there.
A lot or not a lot?
Not a lot, it's mainly
Is that the worst bit there?
Yeah, like this bone a bit here, yeah.
Are you allergic to anything at all?
Nope.
No, fabulous. So what is it you were doing then?
Riding a motorbike.
What, like off-road, like motocross?
Yeah, motocross, yeah.
Alright. So we're going to get some pain relief into you.
Cheers.
Alright, and we'll have a little look at this leg and see what we need to do with it.
Are you having a good time?
I was.
Yeah. Right then. Take these wellies off as well. Sorry.
Pull it off my foot if you want.
Try, I'll hold it.
Yeah.
Try if you want.
As long as I just take weight on your leg there.
Go on, you've got your leg.
I've got you there.
You ready? So well done. Ready?
Out. Go back in. No, go back in, wait. Go back to where it was.
I'll cut them then. Out.
Yeah.
Luke is hardcore, but the pain is the clue Dr. Andy needed. It looks like he's snapped his femur. It's the biggest bone in the body, and a fracture can lead to life-threatening internal bleeding.
Was it bent at a funny angle here?
Yeah, it was kind of twisted. It's like
when he was led down, his leg was sort of
twisted outwards.
Yeah.
Okay. All right.
Luke's granddad saw the fall and called 999.
He just wrapped himself around a tree, came off his motorbike and wrapped himself around a tree.
Sharp scratch in this arm, you ready?
Yeah. I've always been on with motorbikes. I used to ride them when I was younger, and my sons rode them, and now my grandsons are riding.
Yeah.
It's a farm, anyway, we get used to being knocked about every day, aren't we? So you stand so much, I suppose.
So what we're saying we're going to do, we're going to give you some morphine, if that's all right. Yeah. Then we'll get your leg straight and get that splint on, and that will hold it still. And then we'll try and get you to stand down off this while we hold you. Yeah. And then we'll get you onto our scoop here. Okay. Yeah. The other option would be to get the scoop in behind him here. And people hold it while he lays down.
I wonder
and
if that might be
That sounds a good idea.
better.
Yeah. Should we try that?
We've got enough hands, haven't we? We've
once
got
we've got
that
morphine, we'll try that.
Luke's leg may need surgery, and he could still have further undiagnosed injuries. They're going to immobilise him before moving him.
How bad's the pain at the moment?
Not bad, it's just, if I'm holding it like that, it's not bad, it's just constantly there. Like.
How about if I try to straighten your leg? Not straighten, like pull it anyway, but just bend you at the knee. Straighten at the knee.
It was like hurting when the foot came off.
If I lift the leg, do you want us to try and slide that under if we manage it, if we swap sides? So we're going to be as quick as we can, okay? Are you feeling anything from that morphine yet?
Yeah.
You might be just a bit woozy, bit.
No.
Okay, so we're just going to be relatively brutal and try and get this done quickly, okay? Just going to let you straighten at the knee. Just get that welly off if it'll come off, but not worry.
That's it. Nice.
Ow.
Just come on. Just let that drop.
Really well.
It's stuck on the seat of the thingy.
Okay, I'm happy. I'm going to hold that. Should we go around the back and just try and lay him down onto the scoop now?
Have you got that, Andy?
Yeah, I've got it.
Okay.
You're doing well, okay. We're going to get a proper splint on that once we've got you onto the board, all right?
You're doing really well, pal. Really well.
It's vital the team straighten Luke's leg, despite the pain.
Go on, get him under now.
You can get hold of his foot.
Yep.
And just keep that length on there, I'll take the weight of this.
Hang on. You got it? Happy?
That's it, keep the traction on, that's good. Okay, you got it?
Yeah, got it. That's it. So if you guys keep walking. Ready? And down.
The team are going to put Luke's leg in a traction splint, which will stop broken bones from moving and causing further internal injuries. It's a painful process.
So what we want to do now, we want to put a different splint on your leg. We're going to give you an even stronger painkiller called ketamine. It makes some people quite agitated because they get frightened by it. But just accept that's normal and that's what happens, and just try to relax and let that just help your pain. Is that okay?
How are you feeling?
Are you feeling that yet? Yeah. Yeah? Is that helping your pain? All right, good lad.
So we've had 10 about a minute ago.
Cool, all right.
Well done, Luke, you're doing so well. We've got that leg nice and still for you.
The team are going to fly Luke to surgeons at Airedale Hospital, the A&E that serves 5,000 people in the Dales.
Medic 3, air desk, over.
Go ahead, Medic 3.
Yeah, just a bit of an update for you. So, patient with an isolated right femur fracture, which is closed and neurovascularly intact. Obs are all normal at the moment. He's comfortable after 10 milligrams of morphine and just 10 milligrams of ketamine. He's got a Kendrick traction device in place, and he's just on a scoop in the Flexlon at the moment.
So what we're going to do is we're going to fly you to Airedale Hospital. All right.
He has got quite a serious injury, and yeah, kind of the farming folk of Yorkshire are a fairly hardy breed, and you know, often very stoical when it comes to pain, and you have to kind of try to work out how much pain they're actually in. So with him, we just started with some morphine, but it became apparent that putting the traction device on that we had to, just to try to pull his leg back out to length, he needed something stronger. So we've given him ketamine, which it's fairly commonly used these days in the pre-hospital environment, but it's a very powerful analgesic agent, so a very powerful painkiller. But that just allowed us to put the traction device on, get his leg back out to length. And that's really important because that limits how much bleeding there'll be into the leg, because you can lose a lot of blood from a fractured femur. And it limits any potential further tissue damage to nerves, blood vessels, all that kind of stuff.
Ready, steady, slide. Fabulous.
So we've done that. We'll take him into Airedale, which is the nearest trauma unit, and they can have a look at him and manage him further from there.
Okay, the brief. Going to left into the hover, hazards are the tree in front of us, trees behind us, wires over to the left. Got that. Going to lift, and then we'll helipad out of there, back up the hill, forward and left for Airedale.
Okay, happy.
Into the hover, warning units clear, AP trim as expected.
And now we've lifted, routine
Airedale.
Pilot JB will have Luke at Airedale Hospital in just 7 minutes.
So at the moment, Luke's looking fairly stable. We've given him quite a lot of painkillers to help him with the pain. It looks like he's broken the top part of his legs where his femur is. Can be quite a nasty break there, so we'll get to Airedale and we'll see what's going on there.
See those trees?
Yeah.
Just down from the hospital on the left.
Yeah.
I think that's the line of sight there from past experience. So we're going to land there. Visual with the H. All clear, looking good. Aye. Position looks good there, I'll land on.
Roger.
Luke's heading in to meet the surgical team. Farming in the Dales is a demanding job that requires fitness, and this accident could have serious consequences for his whole family. It's early evening at Air Ambulance headquarters. The paramedics are midway through dinner. But food will have to wait.
Guys, I'm going to set you off on this cardiac arrest. It's a runner out on a football pitch with his daughter who's just collapsed. It's on a rugby pitch in Halifax.
In cases of cardiac arrest, seconds count. Jeff must fly 20 miles through the night. On board are paramedics Lisa and George, and Dr. Tim.
Got any update from the scene?
No, they might have a bit of a trek though, because she said it were halfway across the football pitch or something, didn't she?
Nothing on CBH Live at the moment either.
At 150 miles per hour, it's less than 10 minutes to their patient.
Is there somebody on scene already, did they say?
Yeah. It looks like probably, there's certainly a car and potentially a DCA.
Yeah. I'm happy.
The team are using HeliMed 99's powerful searchlight to illuminate the scene below.
Right, so you got DC right at top end? Yeah. Right, got the wires in the low ground there. So what we'll do is, the wind's more or less on the nose. We'll go for that big clearing there, and then we'll just move up the track until we can put it down.
Okay.
Landing at night is fraught with danger.
You've got room to move a little bit more your way, Jeff.
A single telephone cable could cause a disaster.
Just don't go any further left. Yeah, you're good there like that.
At last, they're down.
Are we clear out, Jeff?
Yeah.
In near darkness, the team set out to locate their patient. They're joining a desperate battle to save 56-year-old Jules Collett. Local paramedics have restarted his heart, but he could go back into cardiac arrest at any moment.
Hiya. What's going on?
Out running with his son, witness collapse on a guy, CPR.
Okay.
Been shot and lost at 1832.
Fabulous.
Bundle is done here.
Okay.
Is that a 12 lead ECG yet?
If it wasn't for the actions of his son, Jules would probably be beyond saving. Another jogger came to help too.
I was just out for a run, came around the corner, saw the guy on the floor, a young boy, CPR, and he was already on the phone to the ambulance, I guess. And then the instructions were to get the defibrillator, so I just carried on with the CPR. And then as he came back, all the ambulance guys were here, you know, running around the corner and doing their work.
Jules' son, Henry, is only 12. But tonight, he's given his dad a chance of survival. Jules' heart had stopped completely.
No CO2 at the moment, but we just need to get going, really, don't we?
Well, he's definitely got an output, hasn't he? Because the sats chase is moving. So I won't worry about that. Let's get him on the DCA. I think that's the priority.
The race is on to get their patient to cardiac specialists.
So one shot then, yeah?
Three
shots.
3 shots.
3 were in there, right?
Between us four, obviously, with you at the head end, we'll get him on the scoop. Happy? Is everyone happy with that? Yeah. Come here then, Jules.
We had a blood pressure?
Yeah, we have.
116 or something, wasn't it?
Yeah, 116.
Jules' family are understandably terrified.
Yeah, sorry, are you...
I'm his wife.
His wife? Oh, yeah, sorry, I'm Tim, one of the helicopter doctors. OK, well, his heart's gone into that funny heart rhythm where it stops and he needs electric shocks.
Right.
So he collapsed, we've done the electric shocks, his heart's started beating again.
Right. Is he going to go
so that's
back
great.
to normal? Is he going to be able to...
Well, that's the hope, isn't it? But we won't know for the next, it'll take 24 to 48 hours to find out how affected he's been by it. So what we'll do is we're going to take him to Calderdale. When he's there, they'll probably put him to sleep and put him on intensive care for a couple of days to give the brain and all the body a chance to get better.
Will you be able to see him?
At the moment, you don't normally let visitors on hospital, but we can find that out. Right, we're ready to lift then, guys. Let's all get a corner.
Time is of the essence.
Ready, steady, lift.
And in the dark, even reaching the waiting ambulance is tricky.
Excuse me, would somebody be able to shine a torch on the path?
Yes, love it.
Thanks. So we'll just keep going around here. There's like a little path that leads between the trees. Can you see it? OK, let's keep going.
Just watch your book on your scoop entrance, guys, OK?
I can see the DCA through the trees.
While in cardiac arrest, Jules' brain has been starved of oxygen. Dr. Tim wants to get into hospital care quickly.
Well, at the moment, there's some encouraging signs. So he's breathing on his own. He's got a good blood pressure. His pulse is kind of normalish. So what they'll do is they'll take him to the hospital. They'll keep him asleep for a couple of days, allow his body to recover, especially his brain, and then we'll see if there's any long-lasting damage. But the signs are quite encouraging at the moment.
The actions of his quick-thinking son could have saved Jules.
Definitely where you're going, getting out, etc.
Yeah, everybody out now.
Everyone's out, you're ready to go, just speak on.
But nothing is certain until he's taken to the nearest intensive care unit. The next hours and days will be critical.
See you later.
But another of the team's patients is already making a good recovery. Young farmer Luke is back to work after snapping his leg when his motocross bike hit a tree.
It just happened like that. First instinct was to not let go and not fall off. As I pushed back away, I've shoved myself into the tree. My leg were all twisted, but luckily the bone hadn't come out through it. So if that had been the case, I think I'd have been a bit more worked up about it, seeing my bone coming out my leg.
He required surgery on his badly broken femur, and his pelvis was also cracked in 2 places.
Yeah, I went into theatre the next day and they've put like a I think it was 17-inch 10mm rod, like full length of my leg. It broke about halfway up it there and stuff, and it come like up the side of each other, like that sort of thing. So when I gone to hospital, they had to like pull it down to line the bones back up before they could then put the rod in and screw it to set it back in place. And then my pelvis, just because they were like airline cracks, they said there wasn't really anything you could do. Way out they got worse, they just need time to heal.
He was told to rest for 6 weeks, which isn't easy as a farmer.
I'm back now to being near enough as good as I were, but I'm back out on the farm doing what I love, and better than me stuck inside all the time. So yeah, I'm grateful to be back out and doing what I can do.
At the Topcliffe Air Base, paramedic James is preparing for another busy shift.
On a morning we check, firstly, all of the equipment that the monitor has on board. So we make sure we've got devices to measure exhaled CO2, so we can tell how well a patient's breathing if they're intubated. We've got some blood pressure cuffs and oxygen saturation monitoring, which obviously tells us sort of what the patient's blood pressure is like and how much oxygen's in their blood. So that's sort of relevant for patients who are bleeding in terms of the oxygen, in terms of patients who have difficulty in breathing, shortness of breath, and obviously those who are critically unwell as well.
And James's kit is about to be used in anger.
Okay, 101, 2 good engines. Pulling about 6, blues about 5.5.
He's on board HeliMed 99 with pilot Harry and paramedic Al.
So he could be first on scene here, James. Yep. There's a cruise showing, I think was showing 5 minutes away.
Yeah, no worries. So he sent an update just saying that there's another crew just come clearing Whitby, so he's awaiting an update.
7 bank, Juliet Kilo is 5K to the southwest.
There are reports of a man having a severe reaction to a wasp sting near Whitby. It's a life-threatening emergency.
Anaphylaxis can be really dangerous. It's a condition that results in a sort of a life-threatening airway, breathing or circulation problem as a result of like a stimulus that someone's allergic to. So in this case, the chap being stung.
There's no time to lose. Anaphylaxis kills 20 people a year in the UK.
Right, there is some beach. There's also probably going to be quite a lot of people on it because it's incredibly popular.
Their patient is located near a beach north of the seaside town of Whitby.
Tide's in as well, isn't it now?
Well, it's coming in. Is it all the way in?
It's fairly way in,
which means it will condense everyone on the beach and make it harder to find somewhere to go. I wonder whether the simple thing is just to land up here on the edge of the village.
All along the Yorkshire coast, crowds are out enjoying the sun. But Harry's first landing choice is packed with visitors.
I'm going for this top end of the field, mate.
Okay.
Okay, visual wires coming to that house from that pole, but I can't see anything else.
Nearly 5,000 adults were admitted to hospital for anaphylaxis last year, 1,000 more than the previous year.
London Line, Castle, Coast Guard, Roger, sir. We'll task a team down there now. Many thanks. Out.
That's landed.
Hi guys.
A rapid response vehicle has arrived to take James and Al to their patient.
Oh, look at that.
Anywhere else, Nick?
So this kind chap's just giving us a lift down to scene. We just had to land a little bit away from scene. So yeah, we just popped down.
I'll let you guys jump out there.
Well, thank you very much.
Get this out of the way once you're gone.
The man is being treated by local paramedics in the back of an ambulance.
Hi, I'm James and this is Al.
Bee sting.
Yep.
68-year-old Frank Spirit was having a day out at the beach with his family when a wasp flew into his drink and stung him. An off-duty doctor came to his assistance.
So I was on the beach and there was a red alert, whatever thing.
Yeah.
I came up here, he was on the floor, left side down, GCS3, that's just 60, 70.
Okay, it was Frank, wasn't it?
Frank,
Yeah. Hi Frank, I'm James. I know my colleagues have assessed you. Do you mind if we just have another quick look at you? How are you feeling at the moment? Sweating, I can imagine, mate. Okay, mate, no worries. Where were you stung? No worries, I'm just going to take this off so I can feel your pulse, okay? Ah, that's not ideal, is it? Should have a little listen to your chest, okay? Say that again? I'm really tired. You're tired, I can imagine, buddy. You had all right? Bit of a faint, I think.
Frank's lucky to be alive. His anaphylaxis is the result of his immune system overreacting to the sting.
Yeah, just do some deep breaths in and out through your mouth for me.
James, I'm struggling to breathe. Do you want me to find somewhere suitable to do a transfer?
Paramedic Al knows Frank needs urgent treatment in hospital, but getting him to the helicopter may not be easy.
Yeah. Let's plan to do that. Meet at live at the cricket pitch. Yeah? We might as well just get going, won't we? I'll go back to the aircraft, we'll get the aircraft going.
Yeah, sounds good.
Al is sorting the logistics.
Air Desk Medic 1.
Go ahead, Medic 1.
Yeah, working plan, Lee, at the moment is transfer this guy to the aircraft and then James Cook. I'm just going back to the aircraft now. Where we land is not suitable for a transfer, so we're looking at live cricket pitch over.
Oh. All right, Frank, you're doing really well. We're giving you some fluids and things now, all right, to help with your blood pressure. Do you have any allergies to anything you know of?
I don't know.
Not that you know of.
Yeah, we've completely full responsive.
Yeah, yeah.
Why do you feel stupid? You didn't know the bumblebee was going to come and try and kill you?
Exactly.
I've been stung that many times.
Oh, have you?
You ever had a reaction before when you've been stung?
No.
No?
Harry and Al are relocating the helicopter to a cricket field, which will be easier for the ambulance to reach.
Good on your side? Yeah, we're all good.
So this patient's had a severe allergic reaction, what they call an anaphylactic reaction to a wasp or a bee sting. So the worry with this is that you get a big loss of fluid basically the fluid in your blood leaks out into your cells. And that's what's happened because he's got really low blood pressure. So although he's had all the medication, he's still quite at risk and he's still quite unstable.
You all right, mate? Yeah.
Frank's low blood pressure is causing him to feel drowsy.
Just mind your head, don't bang your head on any of the aerials or anything. Basically, it's a 68-year-old gentleman who's been stung in the mouth by a wasp, and he's had an anaphylactic reaction. Initially on the crew's arrival was GCS 3. He's come up to GCS 14 now. He's got a pulse rate of 120. His SATs were initially about 70% on air, but they've come up to 96 now. We are ETA to you approximately 20 minutes.
Frank will require oxygen and fluids in hospital. The flight will save 20 vital minutes.
Brief. We will lift into the hover, quick check, and then I'll do a helipad straight out. Okay.
Frank's body is in severe shock.
Lift your head forwards for me, Frank.
In the next few hours, doctors will determine whether he'll have any long-lasting effects.
Do you know what's happened in relation to the actual accident?
On the air desk, dispatcher Matty is listening to a 999 call.
I've been going past their job. We've just seen car crashed in banking. Well, we've got out and they've got a woman and 2 dogs in car. Okay.
It's an urgent case for Paul and Andy, and Dr. Paul.
Doors, harnesses, stretcher. Close gear from right. Back in the back. Yeah. We're going to an elderly female that's crashed her car into a ditch. Little unclear how that's happened, but initial reports are that she's unconscious and it's slightly unclear whether she's breathing or not. Some reports that she may have had a fit or a seizure. So a fit or a seizure in that age group is pretty uncommon actually, and often they get mistaken for the initial stages of a cardiac arrest. So we're working on the fact that we're going to a cardiac arrest that probably she collapsed at the wheel and then drifted off the road. But again, it could have been that she's come off the road at high speed and she's got some traumatic injuries. So keeping a fairly open mind on this one at the moment.
From 1,000 feet above, the position of the vehicle is confirming the team's suspicions.
The way that car's positioned, I think, is a medical event. Yeah, it's just gone off the road, hasn't it? Yeah. Unless you swerve or something, you never know, do you?
You know that triangle that you're aiming for? Can
Yeah.
you get out, or is it going to be better off further up on the greener field?
Yeah, try that green field, guys.
What do you want me to bring down, guys?
Nothing for the time being, just
All right.
it's only 2 minutes away.
Alright.
And we are downwind, but patient's 12 o'clock. Roger.
I'll stay here till you've gone up there and assessed.
Yeah, we might have the blood or the vent, or we might have nothing, might we? Yeah. So,
So DCA's there, mate? Yeah, it's just turned up.
Local paramedics have been trying to determine what caused the crash.
Hey up.
I've been just got in. It sounds like probably a medical cause at the wheel come off there. Doesn't look to be a huge amount of impact. It's slowly coming round now.
A passing driver dialed 999.
I was driving past going to doing another job for work, and I seen a lady in banking in a car. I pulled over, went over to make sure she was alright. Put her in recovery position, I called for help.
Obviously it's done so far all fine, so it's just going to try and get her out and have a good look at her on the boat.
The team need 82-year-old Jean Moss out of the car before they can assess whether a medical event could have caused her to crash.
She's not injured. We can sit her up, get a bum on this side at longboard and just carry her onto there.
So what's the plan, buddy? Let's... Hello there, my love. What's your name? Hello there. All right then, I'm just going to get you out of the car, my love, okay? Yeah, no worries, mate. That's it. 1, 2, 3. You're going to have to take a weight there, mate. You got her, buddy.
Jean is in a confused state. The team need to put her on a stretcher so they can safely examine her.
Oh, lay still. Lay still. Hello. It's the ambulance service. You're all right?
Let's just get her strapped on before she decides to wiggle off. Yeah. Okay, guys, have we all got a bit?
Yeah.
Okay, ready, steady, slide. Let's come up. Yeah. Nice and steady. Watch this branch. We'll get her into ambulance and then we'll sort her out. There we go.
Air Desk Medic 3 update. Approximately 80-year-old female. Would appear to be a medical event at the wheel and initially found by bystanders to be frothing at the mouth. Currently she's gradually coming round. BM is 5.1, heart rate's about 80. Blood pressure's normal, SATs are 96% on air. Copy so far?
So far. DCS, we've probably got about 11 at the moment.
But she has got a motor score of 6. We'll squeeze your hands if you ask her to.
Jean's only partially conscious. Paul suspects a neurological problem such as a bleed on her brain.
Jean, open your eyes. It's a bit fluctuant, isn't it?
Kind of like squeezing her eyes shut.
Yeah, she didn't need to go to sleep, mate, I don't think. You know, she's managing everything fine, isn't she? I think LGI, and even then if she's had a little intracranial event, then the right people are there as well.
Yeah. Jean, hello. My name's Paul, I'm one of the paramedics. You all right? Do you know where you are? No. Do you know what's happened to you?
No.
Okay. Well, you've had a little bit of a bump in your car. You've come off the road and ended up in a little ditch, so... Have you got a headache? Hey? Whereabouts is your head hurting? Jean, where's your head hurting, Flower? All over? Okay.
Jean had been driving to see her daughter and had her 2 beloved dogs in the car. They'd been returned to her family.
So we'll take her to Leeds General Infirmary. The reason behind that is she's an elderly lady, and therefore, even though from a crash point of view, it's what we call a relatively low mechanism, so she's gone off the road slowly. Given her age, she could still have some traumatic injuries that she's masking quite well. And the other question is her consciousness level is still not entirely normal, but it is improving, and therefore we can't rule out that she's had some kind of spontaneous bleed in and around her brain. And again, the neurosurgical doctors are at Leeds General Infirmary, so that'd be the best place for this lady to go at the moment.
Jean's accident is a mystery. In the next few hours, doctors at Leeds General Infirmary will try to determine whether she has suffered a serious medical episode that caused her to veer off the road. In hospital, it was found that Jean had suffered a seizure at the wheel. She's never had one before. Neurologists are looking into the cause, and Jean can no longer drive.
Once he's asleep, connect him to a ventilator, put him in the back of that DC and off to the LGI.
Cyclist Pete, who was knocked off his bike by a car in the centre of Wetherby, fractured his skull in 3 places and had a bleed on the brain.
Someone needs to time 60 seconds.
He regained consciousness after 2 days in intensive care. He's doing well, but won't be back on his bike anytime soon.
We might as well just get going, won't we? I'll go back to the aircraft.
Frank, who suffered anaphylactic shock while out at the beach, was found to have been stung by a wasp several times, which caused the reaction. He now carries an EpiPen with him and is much more wary of wasps.
He's had one shot then, yeah? Three shots. He's definitely got an output, hasn't he? Because the chase is moving.
Jules, who suffered a cardiac arrest while out running, spent 5 days in an induced coma in intensive care.
When my dad first woke up, I was so relieved because I still had a dad.
Henry had done a first aid course at school, but doing CPR on his own dad is something he'll never forget.
I turned to Henry so I didn't feel too well when I was going to collapse, and apparently I collapsed at that point.
It was quite scary because he didn't know what had gone wrong. I knew something had happened because he wasn't breathing right. I said in my head, do what you've been taught. The next couple of minutes can save your dad's life, or they can end badly with my dad dead. But thankfully I did what I could and my dad's here now.
Henry's actions that night saved his dad's life, against all the odds.
Hearing Henry talk about what happened that night makes me really impressed and very proud of him. To see that, A, he did what he did from the knowledge he's got, and without any issues. He just did it and had the confidence to deliver it, so it makes me feel really proud of him.
He was found to have a faulty heart valve and was fitted with an implantable defibrillator, which detects irregular heartbeats.
As far as I feel at the moment, I don't have any impairment from what's happened, and I can carry on my life, day-to-day life now as I did before. And that's the very positive side of what's gone on. That the speed of reaction and recovery from everybody else has allowed me to get back to what I was doing literally days before the incident happened.
Jules knows that had he not been with his son that night, things would be much different.
From my perspective, now I'm forever grateful to Henry and hold him in high esteem now for what he's done. And I already did, being his father, but to see him do that, as to what he's done to help me by doing CPR, is truly amazing. And he's kind of set himself up for life with me now as being the go-to person for any issues. He's done really well in that. And I'm very proud of what he's done, from the training he's had to delivering that in reality is unbelievable through how he's done it in a coma. And that's the testament as to why I'm here now.